So I just want to tell you 3 words about the beginning of the book and about Neo, who actually started the writing of the book. We are Neo, the network for Ecohealth and One Health, and we came to idea to write a textbook 5 years ago, and here we are. The work has paid off 5 years later. And we would like to introduce ourselves through the website, which you can see here on the slide. You can go there and see a lot of stuff about NEO, among which is also the book. And if you would like to become a member, you can also fill in the membership form and become one of the NEO family. Our work came when we started working on One Health competences. Then there was one paper came out, and then after that the book came out, also wrapping around the text about the One Health competences. In the book you can find 16 chapters, which are all dedicated to some of the competences, some more, some less, but in each chapter some of the competencies are mentioned, and you can look into them knowingly or unknowingly. But if you want to read explicitly about the competencies, you can also do so. We also have in the book, we also have a glossary at the end, which contains the key terms, and all the key terms are marked in a special way in the book. The whole book is interactive, so it's not a bedtime book. It's a working book where you need to think and work while you read a book. So you can find the key terms, which are marked with the capital letters in a different color. And those are the terms that you can find in glossary. There is also a key concept that is also specially marked, marking an idea, theory, or principle that is critical for understanding. Then there are activities, which are marked in yellow, and there are some learning questions. The questions to those answers can be examples. They do not have to be explicit answer. They can be examples, and we gave you examples in the book based on which you can find your own example. So you can look into the problem or the question from your point of view, having our example as an example. There are also applied examples in each chapter where you can find case studies and examples that illustrate how theoretical knowledge is applied in practice. And these are some examples from the chapters. It also has a special icon. So each of these activities has a special icon and a different color, so that you can go to them directly if you want to go back to something or find out something. Now, back to our today's webinar. Today we are looking into 3 chapters. The first one is social determinants of health at the human-animal ecosystem interface. The second one is gender equality in the context of One Health. And the third one is One Health implementation cycle, stakeholder analysis, and engagement. We also have 3 speakers, Natalia, Elena, and Simon, which will take turns in presenting the book and presenting themselves at the beginning. So guys, as you are the stars today, I will let you begin. Natalia, you can take please over.
Thank you very much, Sarah and Asta. Hello, everyone. Sending my greetings from Colombia, South America. Are you listening well? Is okay the sound? Okay, thank you. Thank you for being here in this promotion with us. I want to thank the editors first, because this book is an example of commitment, of companionship, of transparency, mentorship, and positive leadership. It was an uplifting experience for me, and I learned from you 3, Barbara, Asta, and Sarah, the value of trustful and timely communication, and how teams should work to attain results with integrity, accountability, and wise management of conflict without losing the sense of humor. I want to say that because for me it was a transformative process along the writing of this chapters, and to share with Elena in the chapter 5 and with Simon in chapter 9. I really bow to you because I learned from you a lot, and I really feel I have the positive example of integrity, and also of being heard, and being heard with careful and with yeah, to guide. I also want to thank the co-authors of the chapter 8. We are from Chile, from Colombia, from UK, and inside Colombia, we are from different parts, from Bogota and from the Amazon region. We have also different backgrounds. We have in the chapter nurses, public health officials, and agroecologists. We have biologists and also nurses. So we really learned a lot, not only integrating the concepts, frameworks, and thoughts during the writing of the book, but also during the dialogue and discussion in Bogota, and also in Zoom calls, phone calls, and I will say the heart-to-heart Wi-Fi, because in our chapters we have to really connect different frameworks, and we have also to make wiser choices, and as a collective, it was not easy all the time, but we really tried to present this chapter, no, and that's why I'm here. So we expect that the readers of this chapter really can give us feedback if we really integrate. Can you pass the slide, please? We would like to receive feedback if we attain the learning outcomes. We expect to give some light into the integration of the social dimensions of health for One Health. That is a conversation that we really need to deepen in the One Health community. We really try to during the chapters to think in a One Health and Ecohealth way. This is the objective, one of the objectives of those chapters, and also integrate One Health and Ecohealth knowledge actively, and acquire or enhance core One Health competence, as Sarah was sharing before. The competences that we want to strengthen in our chapter is system understanding, transdisciplinarity, and social and cultural and gender equity and inclusiveness. Their learning outcomes, as you can see, I will say I won't read them, but I think one of the most important that I really put attention into it is the fourth one, because we want the readers to recognize the impact of health inequity at the human-animal ecosystem interface, and how all of them are interconnected. Even if the social determinants of health, can you pass the next one, are a concept that was born in the human health field, or is part of a public health, no, very focus on human health. We try to give in the chapter the sense that all inequities are interconnected. And first, I want to start saying that this framework, the social determinants of health, is a framework created to examine the linkage between human health outcomes and socioeconomic conditions in which people are born, grow, work, live, and age, and the wider set of forces and systems shaping the conditions in daily life. As you can see in the graphic, there are many social determinants of health that goes from a very deep personal determinants, like, for example, gender, ethnicity, the social class. There are other conditions, like the living conditions, like the access to water and sanitation, the quality of the housing, and if they have or not healthy food, the working conditions, for example, education, the type of employment and income, and all of them obviously are determined by macroeconomic and political context that we in Latin America, we can see this in daily life because we are the region, the most unequal region in the world. Since many decades, many years ago, we have this problem, and we haven't had the wisdom to, or the political will to change this pattern. And we also have that in these social determinants of health, there are positive or things that can influence these social determinants of health. That is the health system and the community and social context. So this is like the beginning of the chapter. We have also, and we understand that there's a health gradient, that the better the social position, the better the health, and vice versa. The worse the social position, the worse the health condition. And we wanted to acknowledge different groups, social groups in the chapter. For example, we gave importance to the indigenous groups' conditions, health conditions, and social conditions. We made an effort to really show and give evidence on how those communities, for example, Latin American, the Caribbean, indigenous populations, even if they represent the 10% of the population of the region, they face many social gaps, or despite this unique contribution, maintaining the safe environment, achieving food security, and enhancing the spiritual well-being of society, their impact has been overshadowed by the structural and historical social determinants, like, for example, the lower access to and control of land compared to other social groups, limited education opportunities, access to healthcare services, creating higher rates of mortality or morbidity. So we really wanted to acknowledge the differences and why we believe that even if the social determinants of health is a good paradigm or a good framework, it has some criticism. For example, that is a very anthropocentric perspective. So we believe that with the One Health and Ecohealth frameworks, we can approach, we can give better explanations, and we can understand better those realities. We also believe that in the social determinants of health, we have a unidirectional impact from the structural determinants to personal or individual determinants. And we believe that is not only one direction. We believe that this, the way that people behaves in their territories, or the way that people live, grow, and have this relationship with land, can influence upper layers of the model. So it's a bidirectional model, are more complex, and this framework is offered by the One Health and Ecohealth frameworks. We wanted to give examples in the process of writing the book. So we brought one example. Can you give the next slide, please? We wanted to give an example from Latin America in the Amazonian region, that even if can be a very full, it can be filled with environment and relationship with nature. We know that, for example, in the case of rabies, the outbreaks that we have faced in the Amazon region in Colombia, or in Peru, or in Brazil, there are some factors that contribute that rabies can be fatal, that rabies can have a fatal outcome for indigenous communities. Because when they face a bite from a bat, but they are bitten from bats, by bats, they can die because they don't have they have a close community center, sorry, health community center. They can have precarious housing, being more exposed to those bats, and also they probably won't have the prophylactic treatment soon uh, with the urgency that they need. Now that we have in this month is the fight against rabies worldwide, I think it's important that we recognize that there are other factors that affect the access to those populations to timely treatment, and how even if it's preventable, those preventions methodologies didn't arrive to the people. So this is an example, and I really invite you to read our chapter and to give feedback and to learn from our realities. We have another example from agroecology. This is, for example, the experience of one of the co-authors in different parts of Colombia, bringing the conversation in communities on how important is the health of the soil, because not only human health but also animal health depends on the health of environment, on the quality of the soil, and how agroecology has been fundamental to integrate uh, to integrate the importance of participation, community engagement, and also to empowerment of communities towards health decisions in their territories, and how to cultivate food, how to do the soil management in a wiser way. So it's for us, it's it was a really nice experience to integrate this environmental part that it has been neglected in many examples, or in many parts of, in different contexts, integrate the soil and integrate the communities. That's why we wanted to put that in the chapter. And finally, I wanted the next slide. I wanted to give a message, and that in our chapter we we wanted to acknowledge that the One Health agenda needs to be an equity agenda, because not all countries in the implementation process face the same challenges. And even, for example, in the region where I belong, there are challenges like that are based on human rights, the lack of human rights approach in the implementation, and we wanted to bring that in the table. We know that there are existing frameworks like the socio-ecological systems that have integrated that part really well in the process of books and articles, but we wanted to highlight that people reading this chapter feel more sensitive to those realities, and that if we don't have clean water, how we can implement, for example, better health for animals, or better health for human health, or better health for humans. So we acknowledge the OLEP definitions. We in the chapter, we acknowledge that there is a principle and there is an intention, but we need to go beyond the intention, and we need to really to highlight the best practices and successful examples on how we have reduced those social gaps. We also have the approach of gender and human rights based One Health. I didn't wanted to put an example on that because we had the 9th chapter. This is focused on gender. And obviously, as I mentioned previously, the agroecology is a growing body of evidence that we need to integrate soil and plants. Yes, and finally, thank you. The next slide. I wanted to invite you to read this book that was launched the last week. That is One Health in Colombia. We have an experience parallel to the writing the NEO book, and I learned and the good practices that I learned from the editors and co-authors of this book that we are presenting now. I tried to imprint that with the other co-author, Dr. Carrascal, who we were together in this edition of this book with 54 authors. And I invite you to read it and to expand and share this good news with the Spanish Spanish speaker community. So thank you. I give the word to my colleague Elena to the next chapter.
Thank you, Natalia. Before we give the screen to Elena, I just want to also give one more detail about the book, and that is that our authors are of great diversity. We have around 70 authors in our book, and we started as NEO, like I said at the beginning, but then we decided that we needed diversity. We needed geographical diversity besides all other diversities that we have with our occupations, gender, and different stuff, but we also needed geographical diversity, and we ended up with a lot of authors that are not from Europe, from all over the world, like Natalia herself, and from other parts of the world, and we're very, very proud of that detail from our book. Okay, Elena, if you're ready, I would like you to present first yourself and then your chapter.
Yes. So I'm Elena. I'm since a long time part of NEO network. Been collaborating since 2017, if I'm not wrong. And I'm so happy to be part of this very multidiscipline and multi-ethnicity and gender really open mind group, because this year that I've been learning my first steps to One Health. And then I embrace, thanks to Simon, system thinking and connecting different disciplines and seeing having the attitude to see everything from different perspective. And One Health and the planet need this view more and more. So that's why I want to really underline the need of this book, the need of our nice example of collaboration, as Natalia said. No conflict, but always trying to find with a laugh and to find the same language in different languages, in different backgrounds. And so I'm actually a chemist, but I'm working now with One Health and toxicology and the climate change, and also social aspect more and more, because it's also interconnected. That's why I'm so interested to the gender equality in the context of One Health, because in a way it's the lens, I would say really is the lens. It's like when you put some different type of glasses in front of you to see better. And this is the way that we want to analyze every different disciplines. So our group, the Gender Equality Working Group in One Health of NEO, has also been asked to have a look to the other chapters, to have a look if there's a gender equality aspect and this lens was present. And then it was really, really powerful and interesting for me, as well as being part of a different way to see different perspectives. So that is what I want to say. Gender is not only the sex, and there's much more. So what Natalia has been said also is that ethnicity, where you come from, and your knowledge, your family, your culture, and having also this view on everything can make wiser and really enlarge the visions of everyone. So it's so important right now. That said, now we go to the chapter. So this chapter, as you see, I just want to give a bit of suspense also. But we've been at the beginning saying this important question, how sex and gender interact. Because as I said, many people confuse gender aspect just with sex. It's not only that, it's much more. And then equity and equality. Also, there's other dimensions. So it's like embracing different dimensions. and how this can impact the scientific knowledge and how this can help the planet to be a better planet. And then some methodologies. I mean, sometimes we are all asked to do gender analysis. And here we did step by step the how to do gender analysis. Of course, never forgetting also the empowerment. So how is important to have the empowerment in that? And the main concept. So we took in this glossary the main words that are used in the gender speaking and try to analyze step by step why and what. And we had the pleasure, my actually first co-author in the chapter is Brigitte, and she's very, very, very good and with extreme knowledge as an anthropologist. So she's been helping a lot in discussing all the gender concepts, gender analysis. Also, sometimes we come back to her in publication, in consultancy, just to ask what does she think. And then it's nice, this concert discussion we had all along our the writing of the book. Plus, I think also now we are asked to do, and we just prepared a publication about methodologies. And this is so deep, so important for everyone, because sometimes we are left with scratching the surface of knowledge about gender, but not going deep. And that is this deep that enlarge the knowledge and help really people to do better and to be better. Then it's not only finished. So we did a little analysis of the gender analysis tools present nowadays, and then case studies. I mean, just how to put all this in practice. So we wanted to just go through this. The first is something related to chemicals. So I'm a bit wise about that. This is my work. So how, for example, chemicals affect gender, and how it should be so important to have the gender lens while analyzes a case study. And in particular, when the endocrine disruptors affect mostly the population in some particular phase of life. Like, for example, I don't know if you know already, but I tell you, like a piece of information, puberty, pregnant women, and people in the andropause and menopause. So it can be some window where, of course, is a group of population, and here we come to gender, are more affected by some chemicals that now is ubiquitous, so everywhere in the world. But this is so important to know that part of population, that gender lens. The same COVID-19, we saw how many problems there were for householding and in particular women in that way, that because they were home with the kids and maybe they lost part of the job and so and so and so. So antimicrobial resistance as well, some medicine affect more and different, and then they stay in the body and affect the immune system differently in different parts of the population. Brucellosis, climate change. We wanted also to have this important topic so present now about climate change and gender equality. So with also mentioning the migration of population and the different type of needs that the population will encounter with the climate change and preparedness. And yeah, you can maybe change the slide now. So I remember I play something. Yes. So as in every chapter, you will have this the objectives that in this way there were this what I mentioned, the gender lens in health, agriculture, biodiversity, and climate change. And then identify the areas where the gender gap is more evident. So every publication, every work, every analysis, if has this gender lens, just their vision, you can improve actually every step of the next analysis work. So it's what we wanted to stress, and what we wanted also to say, please ask always a gender expert to help you to go through your work, or try to read the book and be wise with that so you can do yourself. And of course, so many misunderstandings nowadays about the gender concepts. So here we wanted really to give people and students and whoever a very good understanding. So what are the gender roles, equality, equity, discrimination, empowerment, gender-based, One Health. So very, very important for us was to stress out the terminology and the understanding. And yeah, you can change again the, yes. So what is gender? And this is, I guess, something that I wanted also to, in a way, conclude, but also to open the discussion. So you see that is in the middle here of a big sphere when there is acquired relations, given relation of power. So it's actually many things, gender. So we should really enlarge our vision and also in scientific communication, it should be really get better this way to think about gender. So yes, I'm open later for discussion or question if you want, but I wanted to just give the interest to this chapter. And yeah, you can find it, of course, already online, the chapter. So that is very, very good. So yeah, if I guess I can give, because the time is anyway running. So the word to Simon, and thank you very much.
Thank you, Elena. Simon will take over in a minute. I just want to say a little bit about NEO. NEO has started actually in 2014 as a cost action that lasted for several years. And after that, when the cost action ended, we did not want to part. So we decided to stay together and form network for Ecohealth and One Health. But that is not my point. My point is that Simon was one of the first people in the cost action and is one of the authors of our first book, which was a handbook about One Health Index, about One Healthness and other interesting stuff that you can also find on our website and look into it, even though it has been a few years ago. But anyway, it is still very interesting book to read. And now, Simon, if you're ready, you can take over and all the questions will be asked after Simon finishes.
Okay, thank you very much for that introduction. So yes, we've heard about all these requirements, equity, gender considerations, intra or trans or cross-sectoral collaborations, participation, etc., etc. So when you hear all these terms at the beginning, they become quite overwhelming, if not puzzling. And then the question quickly arises, how are we going to put this into practice? I mean, it's nice to think about it, it's nice to talk about it, but how do you do that? So that's where this idea of this chapter came from, where we thought about how do we implement One Health. And so I'm thanking to all the co-authors, which are from all over the place. And as Natalia told earlier, it was a process through which we actually all grew and got to learn about each other. Next slide, please. So when we started discussing about implementation, we realized quite quickly that, we're dealing with an adaptive system. So we are dealing with a moving target, which means that we need to be moving as well. So we need to be responsive, which means that we need to go in a cycle. So that seems something quite trivial. I'll walk you through that cycle quickly. In the chapter itself, we were actually focusing on the participation of stakeholders and the engagement and how we do that best. But there's several other aspects that are quite interesting that are covered in other chapters. So we start at the top in the middle with the problem statement. So your problem statement is going to determine who you're going to invite to the table, but it's at the same time also determining what you're going to do. So it's quite a central question. And because we're talking One Health, it's not such a trivial thing to say, okay, we have a problem with diabetes, because the framing of your question is going to determine how wide you're going to spread the stakeholders that you're going to invite to the table. So if we just talk diabetes, you probably think about medics, you talk about insulin producers, you talk about testing. But if you say a food system approach to diabetes, you would actually have the producers of food, you would have other stakeholders from canteens at schools and whatever. So you can you realize that how you frame your problem statement is going to determine who you're going to get to talk with. So that's your next step in the red zone, where you identify those stakeholders, you start thinking about who is in favor or against what you intend to do roughly, and then you take it to the pink part where it gets even more concrete, because you're going to iteratively start questioning this and bringing people onto the table, and then with them together going to determine what you're actually going to do. So at the end of that pink phase, you have identified the objectives, you know where you're going, you can start reaching out, getting people excited about your idea and getting them on board, which is then the part in the yellow. When people are excited, you need to give them something to do. So you need to co-create your initiative. You need to start identifying how you're going to measure success or progress, and what you're actually going to do. That's the green phase. Then you're going to plan it. You're going to implement it in the teal and in the light blue phase. And eventually you're going to have to evaluate it. So you're going to think about how you have been doing, and you're going to reflect on whether you actually achieved what you tried to achieve. And you might actually think even whether your problem statement was appropriate. And that brings us back to the very beginning. So next slide, please. So what you can realize is that the question defines the inclusion of stakeholders, and the participants define the project or the question. So it's a cyclic aspect, and throughout that process, obviously you're going to have to think about inclusiveness. And inclusiveness brings us back to Natalia's representation in the very beginning about, you know, how do you do that in a fair way, in a way that is not leaving anybody behind. But it also refers to what Elena has been presenting about which genders are going to be represented in your question, which genders are going to be questioned, and are all ways of life going to be considered in the way that your project is being implemented. So next slide, please. There's a number of questions that we have identified, and I'm not going to go through those questions, just to give you the sense of what you can do throughout the implementation process that helps you to keep things on board and to keep an open mind towards the stakeholders that you have at hand. So first of all, obviously the question is, who are the stakeholders, who is concerned? But how then the next question is also going to be, how can you ensure diverse participation? There are people that may not have access to digital tools. There are people that may not be mobile. There are people that may not have access or not have time, etc., etc. So there's many ways that you might be kept from participating. And that brings us to the next question of what barriers exist. You may think about preferences of stakeholders, but you can also think about feedback mechanisms as you further down. So how can we actually get feedback from those populations that may not be represented in the process? So this is just to give you a teaser on what we try to cover in this chapter about how to get to life the promises that we associate with One Health. And with that, I give back to Sarah.